Hello, I am here with Sue Ventresca, who is here to talk about self-care in the educational system. Now Sue, what has been your experience in seeing how people who work in the educational system manage their self-care?
Well, I would say it's like any other population of people. It's the range. You have people who really take care of themselves physically, emotionally, spiritually, that whole person, and you have people who don't have a clue. So the same thing with teachers, principals, healthcare professionals, whatever. So we have some people in the system who are exercising and eating right, and one of the things I know is that health, 50% is on your health behaviors. So we have to exercise because that reduces stress, and if we eat better, that helps with the stress. So we have to know first that those are the things, and sometimes we know it, we still don't do it. But of course we get the other end where we indulge in negative behaviors and drinking and everything else, so it's a range.
Right. And what challenges exist within the educational system regarding self-care?
Well, I think, you spend most of your time at work, and if we don't have systems in place to support healthy behaviors, it could be challenging. If we don't have, if you're bringing in donuts every day, or there's no opportunity to move, those are challenging. And also, I think we do have very high-need kids, and you do get emotionally drained. And when you have, even the younger kids can be physically challenging. The teachers have gotten harmed by students. So, there's a whole range of obstacles to staying emotionally good.
And what consequences have you seen for people who are not successful?
Well, we have a high obesity rate within our educational system, just like the rest of the community. Certainly, substance abuse and alcohol abuse is, we're with the rest of the population on that. So those are the consequences of hypertension, the usual health-related issues related to mental health. Certainly.
And in your own successful practice, what has worked for you in terms of self-care?
Well, I know that your thoughts and what you focus on create your emotions, and your emotions impact on every cell of your body. The research has said it. And so we get into the habits of the way we think. And so I'd like people to stop for a moment, and when something is really bothering them, I want them to take a deep breath and think, do I want this to make me sick? Because we're on a health continuum. Continual stress is going to make you sick. So things are going to happen in our lives. We have to choose consciously how we think and what we focus on. That's my 2 cents.
That's a great point, thank you. And what are your best tips and strategies for successful self-care in the educational system?
Well, I think for everyone to take that deep breath and make a choice. And I think it's an opportunity too, as we're educating our students, to be good role models too. Because if we can stop and take that deep breath and not act or react to a student's negative behavior or outbursts, that helps the whole school climate. So taking that moment just to take a deep breath and think before they act or react, and then try to be calm.
Great.
Nice try.
Thank you so much for coming in and speaking with me tonight.
My pleasure. Thank you.